Welcome to Our Journey to Equity, a show that believes that 1, health equity is a right for all individuals, and 2, the solutions for how we can get there are found in our own communities. So I'm on a journey to find those solutions and amplify them so that health equity isn't something we hope for, it's something we actually experience in our lifetime. And if you're still listening at this point, I'm assuming you also want to experience this for yourself, your family, your children, and your community. So let's see where this journey takes us together. Today, we are talking with Lecresha Sewell, who is the CEO of Melanated Healthcare, which is an organization that matches people of color with racially concordant care. And listen, as a Black woman, I believe this is one of the greatest social justice issues in healthcare and a clear demonstration of the impact of racism on health. Data from the CDC and countless other studies from the National Institutes of Health and others have found that regardless of socioeconomic status, Black women and birthing individuals in the United States are 3 times more likely to die from pregnancy than their white counterparts. Also, Blacks had the highest infant mortality rate among all racial and ethnic groups, and Black African American infants are almost 4 times as likely to die from complications related to low birth weight as compared to non-Hispanic white infants. April 11th through 17th is Black Maternal Health Week. So even if you're watching or listening to this episode another time of year, please share this with other Black women and other women of color, because knowledge is power. And in order for things to change, we must speak and we must act. By the end of this episode, you will know how to use this information to advocate for yourself and for those you love. I'm so excited to have Lecresha here today with us. So let's jump right in. Lecresha, welcome.
Thank you. I'm super excited to be present today and to join you in this conversation.
Well, I have been a huge fan of yours since we were first introduced, I think a couple years ago now. And I'm just so excited to share what you've done with Melanated Healthcare. And so typically, as we start each journey, what I like to do is just explore. How did you get here? What brought you to this point? I have shared my journey multiple times in my first season, and I have a recording for those of you that are listening or watching. If you'd like to see a little bit more about my journey, please go on YouTube, it's there. But for now, we're gonna explore Lecresha's journey. So Lecresha, tell us, how did you get here? Let's explore together.
Well, my journey was certainly non-traditional. When I was an undergrad, I got pregnant. And I always knew that I wanted to have a healthcare career, but I wasn't exactly certain as to what I wanted to do. During my pregnancy, I had to learn how to navigate the healthcare system at a ripe age of 20 years old.
Wow.
I have not lived with my mother since I was 15 years old. So I just having that experience of, again, navigating and figuring things out.
Yes.
I had to learn a lot. And being that I had only been in Louisville, Kentucky for about couple of years. I lose track of time now. I've been here so long.
I
know. but a few years at that time, I had a friend that actually recommended going to a local health clinic. And at that health clinic was where I received care, subpar care, from a health professional who had no clue about cultural competence. She did not educate me in a way that would make me feel comfortable during my birthing experience or leading up to the birthing experience. So I did a lot of self-education, self-work, and I was able to fortunately not have any major complications, but even, like I said, in the birthing experience, it wasn't ideal. I still felt alone. I felt there were things that I still just could not have expected during that experience as a young Black woman.
Right.
And even during my birthing experience, I was surrounded by residents. No one in that room looked like me. It was just not an ideal birthing experience. So at that time, I decided I was going to, I didn't want anybody else to have to go through that if I could make a difference in healthcare. So I was working on my BSN, a Bachelor of Science of Nursing at that time. And still finished in 4 years. I went back to school
Wow.
1 week after I delivered. Yes.
Did you say
so,
you went back to
I was determined
school?
to get it done. And I went on and I worked as an RN for about a year. And then I finally got my break where I was able to go down and work in postpartum, antepartum, newborn nursery in that space to provide care as a nurse. But again, I still felt like I wanted to do more because it was a nurse practitioner that I actually saw during my pregnancy at the clinic. So that inspired me to become a women's health nurse practitioner so I can make a difference in the way that care is received for Black and brown women or people that look like me. So I went on and got my master's from University of Cincinnati and became a women's health nurse practitioner. But fast forward over 8 years in practice as a women's health nurse practitioner, time and time again, I was still feeling like I wasn't doing enough.
Yes.
And that's insane to say, seeing 20 to 30 patients a day, and then having so many patients just come in and sharing their experience. I knew that I needed to do more. I knew that I could do more, and I felt like God was moving me and telling me, like, these seeds that I'm planting are for you to for you to fertilize, to do something with.
Right.
So I, after so much patient feedback about their care experiences, wanting to connect with the Black and brown provider, or a provider that they felt could understand them, that they could relate to, that heard them, that actually listened to them, I decided to create a digital health platform that would allow patients to easily connect with health professionals that look like them, that understand them, that actually see them, which is really the vision and drive behind what we do.
That's so beautiful. I have so many questions about your journey because you said you went back to school 1 week after you delivered, which
I did.
I don't even think I had all of my faculties together for probably years after I delivered my children. So you went back to school and finished in 4 years. Can you tell us a little bit, share with us a little bit about what was driving you? Because you also mentioned that you had not lived at home since you were 15. So what was driving you?
Right. So I've always been very driven, very motivated. So if I decide that I'm going to do something, then just consider it done. So that's my personality, just in general. But I knew as a mother that I had someone who I would have to provide for, to raise, and to be. I had a little brown boy that I needed to take care of. So that was really a driver for me to get it done, to be able to provide a nice living for my child.
That is completely understandable. And I love that you took so many nuggets from your own experience of having a care team that really, didn't necessarily deliver quality care for you at the time, certainly didn't look like you, into what continued your journey into the medical field as a nurse practitioner. And also just thinking about the fact that, there's so much data out there that talks about how racially concordant care, which is essentially having a care provider that looks like you, also providing care for you, actually improves health outcomes. And so as you're working in the clinic and you're seeing patients that are telling you over and over again, man, I'm so glad that I have this person that looks like me in front of me, because there's some things that you just know and that you understand as a culture, right? As a part of your culture, just because of the fact that you understand the lived experience of being Black in America, right? And so there are some things that don't even have to, that can go unsaid, right? As you are providing care. And so at what point did you, let's journey a little bit further and help us understand where the idea or the unction came from. So you had all these seeds, and hearing from your patients how much they valued having a provider of color. But where did the actual inception of melanated healthcare come from?
Well, I don't have a tech background, so I just never even thought honestly, if I had to reflect back, that I would even be in the health tech space.
Right.
That was not in my wheelhouse. But I knew if I wanted to be most impactful, to reach far and wide, and knowing the statistics when it comes to the number of Black providers that are there, I needed to create a platform so that people can come to that platform and be able to make those connections. So that's really where the idea came about. And I knew that technology would be the only way to be able to bring that vision to life.
Wow. And also, I mean, just thinking back on how your personal journey began in basically your pregnancy. That's really where the original seed was sown.
Yes.
And then, you becoming a clinician and working in labor and delivery space. And, like I mentioned at the top of the episode, there are so many health disparities connected to outcomes for Black women and Black babies in the United States. I think it is really incredible that you recognized I can help this many people, right? This smaller percentage of people here one-on-one. But if I just stretch myself a little bit into a space that I am not familiar with, I can help so many more people.
Exactly.
And that takes a lot of faith and endurance. So I think this is a great segue to ask about, tell us about how you endured, stepping into a space that is completely new for you from a tech standpoint, but knowing you're driven by this need to help more people.
You said a word, faith and endurance. Well, 2 words, faith and endurance. Every day I wake up and I'm like, some days I'm just like, how did I get here? What in the world am I doing today? But I'm grateful to be surrounded by a team that has the same passion, the same drive, and believes in the mission of what we are doing, what we're creating, the access that we are providing for patients. So that has really been I feel like the way to get it done. Just having that community is truly a blessing, honestly. I will say, as far as the scaling part of it, that has been eventful. Just being a Black woman, woman-owned business. Most people know that VC funding is only like 0.3% for us in the United States, and 2% for women in general. So we hardly get any funding.
Right.
So thankfully, I've been able to get grants from companies such as Humana, where I'm able to implement the maternal telehealth initiative pilot that we're doing, and just different things that we're, like I said, the community's coming around us, coming together, and really being supportive of our mission and our goals.
Yeah, that's such a true and sad statistic of how few Black-owned organizations receive funding, especially seed funding, when it comes to needing to take a business to scale. And having relationships in the community, from what I'm hearing from folks that I've interviewed and just, different community partners that I work with as a part of my full-time job, I know how important it is to have those relationships that can help connect those dots for you, because there's an inequity even in how our organizations are able to be funded and thrive. So can you tell us a little bit about Melanated Healthcare? For those that are listening that don't know anything about it, this is their first introduction to it. Tell us a little bit about what Melanated Healthcare is.
Yeah, so Melanated Healthcare, we are a digital health platform and a credentialed telemedicine practice that helps connect Black, people of color, and underserved communities to health professionals that share the same racial or cultural background. Our goals are to decrease health disparities that exist and really close the gaps, bridge those gaps in care, by positioning ourselves as a partner in care. Our platform is available in the App Store, Google Play, and we also have a website. And we are eager to grow, looking to help as many patients as possible and connect with as many Black and brown providers as possible to help ensure that patients receive the care that they need.
That is awesome. And, I think so much about my experiences as an individual that is, well educated. I've got private insurance, and one of the things that I look for when it comes to my care is a provider of color. And I will say, it was important to me to have my OBGYNs and the practice that I went to have Black women there because of, just the disparities with maternal and infant health in the United States. It was also important for me to make sure that my primary care, my, just general care that I receive is from someone of color. And I will tell you that my primary care physician actually is not a Black African-American woman. It is a woman of color. But what really interested me about her, which I think is something that's very unique for melanated healthcare, is that her cultural experience has been very similar to my own. And that's what really attracted to me to her as a provider, because she also, we share a lot of cultural similarities. And so when I met her, I felt like she knew me already, right? She knew my journey already. So sometimes it is race that makes you feel more comfortable with someone, but sometimes it really is making sure that you're connected on a cultural level. Yeah. So how has melanated healthcare sort of evolved since its inception? And where do you see things going?
Yeah, I love that question. So our grand vision is grand, but where we started was just a directory. I had no idea that it would bloom and blossom into what it is today, but the whole purpose behind it was just to be able to provide a reference, a resource for patients. So it started out as just a directory of multidisciplinary, multi-specialty Black and brown providers. Then we went ahead and got credentialed as a telemedicine practice to ensure that access was actually being provided.
Oh, wow.
And that came about because I felt like, yes, I was providing a resource and a tool, but my whole mission, my whole drive and vision was to ensure that patients can actually access. So what better way than to provide telemedicine, telehealth to the patients? So that was the next step. And so we are excited about the credentialing and can accept insurance. Most insurance is actually commercial and Medicaid and Medicare here in Kentucky, and looking to roll out and expand as we continue to partner with different payers. And then long term, we want to implement some cutting edge technology such as AI to ensure the matchmaking is there and efficient and totally up to par to meet all of our patients' needs. So going forth, the technology will continue to be developed, and the innovation will certainly be there.
I love that, because so many times when you think about tech or new things that are emerging in healthcare, people of color and individuals living in marginalized communities are often left out. Left out of research, left out of innovations. I mean, just completely cut out of the equation. And so then when these services scale and they're offered, they don't really address the needs of more than just one or two groups of people, right? And so I love that you all are really on the forefront of, we can use AI for people of color to help people of color, right? We can be included. And that is a beautiful way to think about how you actually achieve equity. Yeah. So, okay, tell us a little bit about what we can expect if we are going through the process. What have your customers said, or clients, patients? Not really sure how you refer to the individuals that use your services, but what have been some of the experiences that they've had?
I've gotten some really great feedback from the patients that have navigated our platform. Most of them are able to find the provider of various specialties. I even just recently met with someone randomly, and they were really excited that they were able to find a PCP through the platform that they were able to connect with and have a really good relationship with. Some of the customers on our platform are in different regions that we have not been able to penetrate just yet. But again, being able to get the word out, we're hopeful that they will be able to tell the providers about us in their area, or the providers that are in the area will try to get on our platform, request to get on our platform, and we would happily receive them because patients are actually looking in different areas. And we get that feedback quite a bit depending on the specialty.
Oh my gosh, that is so awesome. And it doesn't surprise me at all. Many of you know that I came from the hospital side and worked with the hospital and healthcare provider side for over a decade. And one of the questions that I would get asked a lot in the community is, why can't I just filter my search, for a doctor by race? And that's actually a major compliance issue because individuals could use that filter to discriminate against different providers because of their race. And so you won't be able to find that. Really, for any healthcare system out here, you won't be able to filter by race. So it doesn't surprise me at all that you're getting such strong interest, especially in communities that you're not even in yet, because it's such a huge need. Is that something that has surprised you? Tell us, what has surprised you as a part of this journey?
I don't think that the expression of and the desire, shall I say, is surprising at all. I mean, just again, from a personal standpoint, navigating the health system to even just my professional experience, that part isn't surprising at all. I think more on the demand in different areas so quickly.
Yes.
I think that was the biggest surprise. I just didn't expect it to get out of Kentucky so soon.
Yes.
So not that I'm disappointed whatsoever, but and I pray that I will be able to make those connections soon and all nationwide. That's really the goal and beyond, honestly. But just really surprised at how quickly it rolled out to other areas that we just hadn't even marketed to yet.
Yeah, well, word of mouth is definitely out there. And the need is so great, which is probably why it's spreading so quickly. Like, oh my gosh, can you believe there's, finally a way for us to find care from someone that looks like us and that's a part of our community. So kudos to you. I mean, I cannot tell you how excited I am about your work and melanated healthcare and seeing all of the expansion that's going to happen. So we've reached a point in our journey where really it's time for us to elevate you. Obviously, this is a growing need. This is a need that's been there, right? But the interest is starting to grow. So tell us, how can we continue to support you? How can we elevate your work?
Thank you for that question. To start, we would love to have more strategic partners. Payers and employers are high on our list, health professional organizations, just sharing our work on social media, telling a friend, telling the health provider, word of mouth, like you said, is like the best advertisement.
Yeah.
So just those things would be super helpful for our growth and for us to reach far and wide as far as our patients or clients, shall I say, and the providers as well.
And where can people find you?
So we are on Instagram, we are on Facebook, we are on Twitter, we're also on LinkedIn, and we do have a Threads and TikTok. So we are pretty much on all the social media platforms under Melanated Healthcare. So just the company's name.
Awesome. Well, fam, you heard it. Follow Lecresha on her journey at Melanated Healthcare. And thank you for joining us on another journey. If something you heard here resonated with you, follow our show or follow Melanated Healthcare. Share this episode with someone you care about. Because remember, inequity and injustice thrive in silence. And the only way for us to have the world that we want our children to inherit is to speak up and to act. Quality healthcare is not a privilege. It's your right. Remember that. See you on the next journey, fam.